Good morning, students. Today we are going to discuss the hip bone. This is an irregular bone which is forming the pelvic girdle. These two hip bones with sacrum and coccyx, they form the bony pelvis. Now this hip bone is basically formed of three bones, that is ilium, pubis and ischium. Now how we determine the side of this bone? The upper end, which is the expanded one, it should face upwards. Obturator foramen should face inferiorly, and this cavity, which is known as the acetabulum, that should face laterally because it has to articulate with the femur bone. And this obturator foramen is bounded anteriorly by the pubis and posteriorly by the ischium. So this bone is of right side. If we hold the bone like this bone is of right side. To know the anatomical position, for that we have to keep the anterior superior iliac spine and this pubic tubercle, this elevation, pubic tubercle, they should lie in same coronal plane. This surface of the pubis, it should face upward and backwards, clear? And this ischium should face posteriorly. So, and pubic symphysis, this is the medial surface of the pubis which should face medially. So these are the point for keeping the bone in correct position. So this is the anatomical position of the bone. Now first we will discuss the ilium. So this ilium, you can see it has upper broad end, which is known as the iliac crest. It has lower narrow end, which is contributing to this acetabulum, that is 2/5 portion of the acetabulum. So 2/5 portion of the acetabulum is contributed by the ilium. Now this upper end is known as the iliac crest. You can see it is sinuously curved. The highest point of this iliac crest is just lying behind the midpoint of this iliac crest. So it is just lying behind this. So this is the highest point of the iliac crest. Now this iliac crest has two segments. It has ventral segment. This is the ventral segment and this is the dorsal segment. This ventral segment has outer lip, it has inner lip and it has intermediate area. This outer lip bears the tubercle, which is known as the iliac tubercle. Now this dorsal segment of the bone, you can see this is the dorsal segment which has medial slope and it has lateral slope, and this is the intermediate area. So ventral segment has two lips, outer and inner lip, and dorsal segment has two slopes, that is lateral and medial slope. Now this bone has three borders. This is the anterior border and this is the posterior border. From this side if we see, this is the anterior border, this is the posterior border. Now the anterior border of the bone bears the anterior superior iliac spine, then a small notch, then anterior inferior iliac spine. This posterior border, it has posterior superior iliac spine, then a small notch, then posterior inferior iliac spine, then it formed the margin of the greater sciatic notch. It formed the upper margin, apex, and upper part of the lower margin of the greater sciatic notch. So this is formed by the posterior border of the ilium. The third border which is present in this bone is medial border, which starts from the iliac crest, running downward and ending up to the iliopubic eminence. So this is the medial border. This medial border is rough in the upper portion and it is smooth and rounded in the lower portion, and this forms the iliac part of the arcuate line. So in between these borders, so three surfaces are there. This is known as the gluteal surface between anterior and posterior border. On this side between medial and anterior border, this is the iliac fossa, and behind this medial border, and this is known as the sacropelvic surface, which is lying between the medial border and the posterior border. Now if we see the gluteal surface has three lines. First line is the posterior gluteal line. You can see it is starting about 2 centimeter in front of this posterior superior iliac spine. So you can see the rough area, and it is ending in front of the posterior inferior iliac spine. Then it has anterior gluteal line, which starts from the anterior superior iliac spine, running backward, going downward and reaching up to the upper margin of the greater sciatic notch. So this is the anterior gluteal line. So posterior gluteal line is the smaller one. You can see here, this is the posterior gluteal line, this is the anterior gluteal line, and this is the inferior gluteal line, which starts from the anterior inferior iliac spine and ending up to the apex of the greater sciatic notch. So these three gluteal line, they encloses the four surfaces from where the different muscles they are getting origin, that we will discuss in our next video. Now coming to the this side, that is pelvic side, this is known as the iliac fossa. So this is known as the iliac fossa, from where the iliacus muscle is getting origin. Behind this is known as the sacropelvic surface. This sacropelvic surface has upper rough margin area, which is known as the iliac tuberosity. Then it has auricular portion, which articulate with the sacrum. Then beneath this auricle, there is a sulcus, which is known as the preauricular sulcus. Then it has a smooth portion, which is known as the pelvic portion, which forms the wall of the pelvis. So this is known as the sacropelvic surface. Now coming to the pubis bone. This pubis bone is placed lying anteriorly. It has body and two rami, superior ramus and inferior ramus. Now first we will discuss the body. Body has anterior surface, it has posterior surface, it has medial surface or symphysial surface, which forms the pubic symphysis when it articulates with the opposite hip bone. Now when we place the bone, the body, the anterior surface of the pubis should face directed inferiorly and posterior surface is facing upwards. Now it has one border. This body has one border. This is the starting from this medial end up to this tubercle. You can see there is a tubercle. This is known as the pubic crest. So this is the border of the body of pubis. So from this pubic tubercle, here there is a ramus. Now this ramus has three borders and three surfaces. First, this is the inferior border. You can see it is forming the margin of the obturator foramen. Then it has obturator crest over here. Then it has superior border. This obturator crest is facing anteriorly, so the another name is the anterior border. This is the superior border or pecten pubis. You can see here, this is the pecten pubis, which is continuing with the medial border of the ilium. So this is the pecten pubis or pectineal line. In between the pecten pubis and this anterior border or obturator crest, this is the pectineal surface. Between this obturator crest and this inferior border, this is the obturator surface. Between this pecten pubis or superior border and this inferior border, this is the pelvic surface of the superior ramus. Now coming to the inferior surface. Before that, I want to tell you this pectineal line is forming the pubic part of the arcuate line. So the medial border of the ilium was, this smooth part is forming the iliac portion of the arcuate line, and this is forming the pubic portion of the arcuate line. Now coming to the inferior ramus. Inferior ramus, it joins the ramus of the ischium to form the ischiopubic rami. It has anterior surface, it has posterior surface. Now coming to the ischium. This is ischium, which is broad and large portion. It has three borders. This is the anterior border, which is forming the posterior margin of this obturator foramen. So this is the anterior border. Then exactly opposite to this is the posterior border. This posterior border is continuing with the posterior border of the ilium. Now this posterior border is forming this is the lesser sciatic notch, then ischial spine, then lower part of this greater sciatic notch. As I have told you, the upper part of the lower margin, apex and upper border of this greater sciatic notch is formed by posterior border of ilium. So the greater sciatic notch is completed inferiorly by the posterior border of the ischium. So this is the posterior border. Now coming to the lateral border. This is small, which is rounded at the upper margin of this tuberosity. So this is small border. Now coming to the surfaces. Between this anterior border and lateral border, this is the femoral surface. Between this lateral border, this is the lateral border, and this is the lateral border, and this is the posterior border. In between this is the dorsal surface. So this whole is the dorsal surface of the ischium. Up to this is ischium, which is showing the upper convex area, then grooved area, then this tuberosity. So dorsal surface has three components: convex area, grooved area, and tuberosity portion. So up to this, as it is meeting the ilium at this point, it is forming the, or it is contributing to the posterior and inferior part of the acetabulum, that is 2/5 portion. So 2/5 portion of the acetabulum posteriorly and inferiorly is contributed by the ischium. Then coming to the pelvic surface. So pelvic surface is lying between this anterior border and the posterior border. So this is the pelvic surface of ischium. So there are three surfaces and three border for ischium, and there is one ramus which articulate with this ramus of the pubis to form the ischiopubic rami. So this is all about the different parts of the hip bone and the detailed attachment of various parts that we will discuss in our next video. So kindly, if you like this video, kindly like it, share it and subscribe it. Thank you very much.